Well, good afternoon. Hi, everybody. This is a very fun crowd, I can tell. Everybody's talking and enjoying this beautiful sunny afternoon. Contrary to what you see on the screen, I am not Palmetto. I am, however, Andrea Pauls-Backman, and I am the Executive Director of the Les Turner ALS Foundation. And I want to welcome all of you here today. This means a lot to have you all here at our annual ALS News You Can Use. This is a meeting that we've done every year. We generally pick different topics each time, and so obviously you know the topics we're going to talk about today. But let us know if there is something in particular that you're interested in that you'd like us to touch on at next year's meeting. Obviously, you're here because you work with one of the members of our team, and all you need to do is let me know in the office, let one of the team members know, and we'll see what we can do to make sure we get the information out. This meeting is one of the many, probably several dozen, community education events that we do throughout the Chicagoland area throughout the course of a year. We do in-service work with hospices, with nursing homes, with other care providers, because really what we have learned over the 40 years that we've been in existence here in Chicago is that the need for ALS training, the need for ALS education, the need for ALS awareness is always there, and it's growing. ALS is still considered technically a rare disease, but as you look around the room, we realize rare doesn't mean anything, because you're all here for a reason. We're all here for the same reason. So this is one of the many things we do throughout the ALS community, in addition to the research that we conduct at the Les Turner ALS, the research that we fund at the Les Turner ALS Research and Patient Center at Northwestern, and of course the Lois and Solia ALS Clinic. So between the work that our home team does, who Judy's going to introduce in just a moment, the work we do at Northwestern with research and patient care, and really the feedback we get from you are all the components that are so incredibly important to our mission of finding a world, creating a world without ALS. So I want to, at this point, introduce Judy Richmond, who is our Director of Patient Services. I'm sure many of you know her. And just to let you know that after today's presentation, I'll be around for a while. So please come up and say hello and let me know if there's anything more we can do. So thank you for being here. Judy.
Thank you. Thank you, Andrea. And I'd also like to welcome all of you to what I think is going to be a very informative afternoon. But before we start our program, I would like to introduce some people who are in the audience. First of all, we have some board members who are joining us. We have Dr. Scott Heller, Joel Schechter, please stand up, Mary Lou Pisoni. So thank you all for coming and spending a Sunday with us. But I want to introduce the most phenomenal group of women I get a chance to work with every day, and this is the members of the home and community team. I think many of you have met with one, two, or even three of them at some point in time. So our nurses, Eileen Mindell, they're all in the back of the room. So raise your hand. So Eileen, Julie Stoll, Karen Steffens, Colleen Jordan, up here. Our social workers, Lori Fieldman, Easton Stevenson, and Cara Gallagher, who is our ALS Registry Associate. Ladies, please stand. Acknowledge yourself. And just a couple of quick housekeeping things before we get going. Bathrooms are to the right. There's water in the back of the room. And we're going to ask, we have a couple of speakers today, so I'm going to ask that questions are held until after each speaker is done with their presentation. Then we'll have a question and answer period. And after the program, we have a little reception across the hall. But also to let you know, the presentations today are being videotaped. So meaning we're going to have these on our website with links for people to access them, so you don't have to worry about writing things down and catching everything, because they will be online. And the last person I need to introduce and thank is my sister, Lynn Richmond, who everybody thinks is me. And Lynn is our official photographer for today. So thank you. My sister comes to, I can't tell you how many programs. And then, so, on to our program. We have 3 speakers with us today. We have Dr. Paul Mehta, Dr. Lisa Wolf, and Sherry Dvorak. Our first speaker is Dr. Paul Mehta. He is a medical epidemiologist at the Centers for Disease Control in Atlanta and is the principal investigator for the United States congressionally mandated National ALS Registry, which many of you in this room are already currently enrolled in. Dr. Mehta will be talking today about the registry and the impact that all of you have by participating. Dr. Mehta.
Oh, okay. So, thank you so much for inviting me here. I want to thank Andrea and Judy and the foundation for the opportunity to come here and speak about the registry. Before I get started, this is your registry. I'm just a caretaker of it, and I'm here to go ahead and let you know what we're doing in the registry, and afterwards I'm here for any questions you guys may have about the registry. Disclosures, none to disclose. Very quickly, the outline of the presentation itself, I'll be doing a very, very brief background on the registry, all the facets of the registry as well, our second report, which was published last year, findings, as well as how we're connecting persons with ALS and researchers, our publications we've done, as well as the National ALS Biorepository, which currently is live, how we fund research and what research we fund, as well as an upcoming event called CDC Public Health Grand Rounds, happening on April 18th, as well as activities for 2017. And conclusions and questions I can go ahead and take. Just very quickly, so the registry came about many years ago. Back in 2008, Congress passed the ALS Registry Act, and that was that really, as in terms of formulating the registry itself, that was possible by the hard work of persons with ALS, as well as caregivers, pushing Congress to go ahead and pass an act or some sort of legislation to go ahead and make the registry, as in terms of, as in terms of having much more codified or much more focus on ALS research. So the registry, so the act itself, what it does is it's got multiple purposes. One of the purposes is to look at the incidence and prevalence of ALS, which means new cases as well as existing cases of ALS, as well as describing the demographics of disease, who gets this disease, as well as looking at the risk factors for the disease, that is funding risk factors, etiology, the causes of ALS. It does not make ALS a notifiable disease. When I say notifiable, there are many diseases out there such as, let's say, tuberculosis or HIV, which are notifiable. What that means is if someone gets diagnosed, they're reported at the state level and eventually at the federal level. ALS is not that particular disease. It's not a notifiable disease to states. I'm not going to get into the actual methodology of actually how we go ahead and ascertain cases, but the registry pretty much is a two-prong effort, methodology-wise, where we look at we get cases from the national admin databases such as Medicare, Medicaid, the VA system, as well as the online portal as well. And the online portal are individuals who come on to the website, answer a series of questions, and they're registered on the as a registry enrollee. This slide's kind of important. I want to emphasize that the registry does a lot more than just count cases. There's a misnomer that, hey, we just do a lot of case counting, seeing number of cases on a national level. That is one facet of the registry, but we do a lot more than that. So I'll be talking about the National ALS Biorepository and how we're pretty much, as in terms of working with that to go ahead and expand the research on ALS, as well as the epidemiology of ALS. Our partner organizations such as Les Turner, as well as our survey data, which is currently over 60,000 completed surveys, and these surveys are available for persons with ALS who come to the website and enroll and take these surveys. as well as how we are connecting patients with clinical trials as well as epi studies through our notification system. And then finally, I'll be talking about the research we're funding for ALS, looking at etiology, risk factors, and so forth. Some of the findings from the second report, which was published last August and covered calendar years 2012 and 2013. In 2013, there were almost 16,000 cases of ALS in the U.S., and that equates to a prevalence of about 5 cases per 100,000. We know ALS continues to be more common in whites, males, and persons between the ages of 60 and 69. The lowest number of ALS cases are those between the ages of 18 and 39 and after the age of 80. Males have a higher prevalence than females across all our data sources. This slide kind of shows you the actual breakdown when it comes to the age group itself, where you can see people who are, persons who are ALS who are between the ages of 18 and 39 have a very, very low prevalence rate, and it kind of increases as the age increases and declines after the age of 80. These right here are our risk factors, which I mentioned. So these are available to take for persons with ALS when they come to the website, and they can answer these survey questions. We currently have 17 surveys. These surveys are wide and varied. So we have demographics, we have occupational history, we also have smoking alcohol history. And the purpose behind these surveys will allow us to go ahead and figure out, as in terms of risk factors, etiologies, possible causes, that is, of ALS. We also have one survey, which is an open-ended survey, which allows persons with ALS to go ahead and tell us how they feel or what they feel may have caused their disease. So currently we have almost 65,000 completed surveys. The first currently working on analyzing the rest of the surveys as well. This probably is the largest collection of ALS epi data in the world when it comes to looking at persons with ALS with clinical trials and epi studies through our research notification system. Some of you may have received an email from us saying, hey, there's a new study. If you're interested, please go ahead and contact a particular researcher. So this system right here allows us to go ahead and kind of like be the middleman, go ahead and have individuals, institutions come to us, apply to go ahead and use our system, and we will go ahead and send an email out to the individuals who consent to receive information about the research trials and so forth. And this right here is really taking off. It allows us to go ahead and work